So today we are going to look at the interior of the heart. We are going to look at the interior of the right atria, left atrium, right ventricle as well as the left ventricle. But before that we'll look into the anatomical position of the heart. So since you already know the surfaces and the borders of the heart, we'll try to learn how to place the heart in the anatomical position. Okay, so first you have to place your left hand like this, the flat, then place the inferior surface, because you know this is a sternocostal surface and this is a diaphragmatic or the inferior surface. So you have to place the inferior surface resting on your left hand and the apex should be facing towards the left side and sternocostal surface facing anteriorly, and this would be the anatomical position of the heart. Okay, now we'll discuss about the external features in the interior of the right atrium. So as you know, the right atrium, it forms a part of the sternocostal surface. It also forms the 1/3 of the base of the heart, and it's also forming the right border of the heart. Now what are the other external features you can see? So here you'll be able to see a sulcus, which we're calling it as a sulcus terminalis. On the inside it will be corresponding to the crista terminalis. Other structure what you can see externally is a ear-shaped extension antero-superiorly, which we're calling it as right auricle. Okay, so this is known as right auricle. So externally that is how you will see the features. And so if you just make a cut section along from the superior vena cava to the inferior vena cava and we open the right atrium. So what are the internal features or the interior features of the right atrium? So as you know, the interior of the right atrium is divided into two parts. One is a smooth part, the posterior smooth part, and the anterior rough part. Posterior smooth part and the anterior rough part. Okay, so posterior smooth part, as you know, it is also known as sinus venarum, and all the veins open into the sinus venarum part. So we'll look into the features of this sinus venarum. So as you know, what are the structures which are opening, what are the veins which are opening into the sinus venarum? We have the superior vena cava, we have the inferior vena cava, and we're also having the coronary sinus and foraminae venarum minimarum. So we're going to look at the structures now. So first you can see this is a opening of the inferior vena cava. As you can see, the opening of the inferior vena cava, it is not guarded by any valves. You can see there is no valve there. Okay, and here in the upper part of the opening of the superior vena cava, here the SA node will be lodging here. Okay, now the other one is a inferior vena cava. So this is the opening of the inferior vena cava. So this opening is actually guarded by a valve. Okay, you can see here, this is the valve here. Okay, this is a valve, which is just a rudimentary valve, and the name of this valve is a Eustachian valve. This is known as Eustachian valve. Okay, the other opening what we can see here is a opening of the coronary sinus. Okay, posteriorly I'll try to show you where the coronary sinus is. So here we can see this is a coronary sinus in the atrioventricular group. Okay, so this is a coronary sinus which is opening onto the interior of the right atrium. Okay, so I'll try to show you the opening of the coronary sinus. So this one where I kept my forceps, so that is the opening of the coronary sinus, and here we can see it is guarded by an incomplete valve. So it is guarded by an incomplete valve, which we are calling that as a Dissection valve. Okay, so 60% of the venous drainage is through this coronary sinus. Okay, and the other openings what we can see is even on the septal wall we can see small openings here. Okay, all these are the small openings you can see. So these small openings we are calling them as foraminae venarum minimarum. Foraminae venarum minimarum. Okay, onto this small veins open on this foraminae venarum minimarum, and the names of the small veins is, they are known as vena cauda minimarum, or we can also call them as Dissection veins, which open on this foraminae venarum minimarum. Okay, so that is about the smooth part. Okay, in the smooth part we discussed about 4 openings: superior vena cava, inferior vena cava, coronary sinus, and the foraminae venarum minimarum. Okay, so now we look into the other part, which is the anterior part, which we call it as a rough part, or we can also call it as a atrium proper. Okay, so atrium proper, you can see this is all the rough part, you can see it is all rough. So what are the structures you will see in this atrium proper? So first one is, along the sulcus we said there is a smooth muscular ridge which we calling it as crista terminalis. So this smooth muscle ridge what you are seeing here, this is known as crista terminalis, which is corresponding to the sulcus terminalis. Other structure what you can see is, so from this crista you can see many muscles are arising, which we calling it as musculi pectinati. Okay, these muscular ridges we calling them as musculi pectinati. So one more important point for us to remember here is, even in the auricle, okay, even in this auricle also we'll be having this muscular ridges. Even in the auricle we'll be able to see this muscular ridges. So this auricle actually forms a potential site for the formation of thrombi, because blood comes and it gets clotted here. So this is a potential site for the formation of the thrombi, and if this thrombi gets dislodged, it forms an emboli, it goes into the pulmonary trunk, okay, and it forms a pulmonary embolism within the lung. Okay, so that is a clinical point we have to remember about this left atrium. So what are the other structures we will be seeing in this atrium proper is the atrial septum, the interatrial septum. So this is considered as a interatrial septum, because on the other side we can see the left atrium is present. So this is a interatrial septum. So what are the important features for us to learn in the interatrial septum is a, so now we are looking at the structures present in the interatrial septum. So there are around 3 structures. Okay, what we can see is a fossa ovalis, next we will see the limbus fossa ovalis, and one more is a triangle of Koch. Okay, so first we are looking at the fossa. This is known as fossa ovalis. I think you can appreciate the fossa. This is the fossa, and this is embryologically it is made up of septum primum. Okay, so around this fossa you can see there is a margin which is present, you can see, which is known as limbus fossa ovalis, which is also known as annulus ovalis. Annulus ovalis or limbus fossa ovalis. Okay, so these are the 2 structures you can see, and one more is a triangle of Koch. Okay, so this triangle what you are seeing here, this triangle what you are seeing, this is known as triangle of Koch, where it is bounded, okay, in front by this atrioventricular orifice, okay, or the annulus you can see, and behind we'll be having the coronary sinus, okay, and above you'll be having a tendon here. Actually, if you keep your finger and you palpate, you'll be able to feel a subendocardial tendon, which we call it as tendon of Todaro. Okay, so this is forming one triangle, which we call it as triangle of Koch, which is actually lodging the AV node. So this triangle is lodging the AV nodes. Okay, so that is the importance of this. So one more structure which is there, which is known as torus aorticus. Okay, so torus aorticus is a bulge you can see here in the interatrial septum, which is formed by this non-coronary sinus. Okay, so those are the structures we can see in the atrial proper. So now we will discuss about the atrioventricular orifice. So this one is on the right side, so this one we calling it as a atrioventricular orifice, through which you can see it is communicating with the right ventricle. Okay, so now we will discuss about the interior of the right ventricle. So as you know, interior of the right ventricle, it is having 2 flow tracts. Okay, one is known as a inflow tract. You can see this is a inflow tract where the blood is entering from the right atrium into the right ventricle. Okay, and the other one is a outflow tract from which the blood is entering from the ventricle and it is going into this pulmonary trunk. Okay, so that is a outflow tract. So as you know, the inflow tract is having 2 parts. One is known as a tricuspid valve complex. Yes, the other one is trabeculae carneae. Okay, so first we will discuss about this tricuspid valve complex. As you know, it is having 4 structures. Tricuspid valve complex, the first one is a atrioventricular orifice, the other one is a tricuspid annulus. Okay, so this is a atrioventricular orifice. So if you actually keep the heart in its anatomical position, you can see the opening is almost vertical. You can see the opening is almost vertical, where the blood is entering from the right atrium into the right ventricle at a horizontal level. You can say it is going horizontally. Okay. So this is known as, so to which the valve, the leaflets are attached, that one we calling it as a tricuspid annulus, which is formed of this collagenous ring. Okay. So why are we saying tricuspid is because it has 3 leaflets. I think you can appreciate the 3 leaflets. This is one, this is the second, and this is the third one. Okay. So we have an anterior, posterior, and we're having a septal leaflets. Okay. So those are the leaflets. Other 2 structures what we can see are the chorda tendinae. Okay, so these structures what you're seeing here, these are known as chorda tendinae, which are originating from the papillary muscles and they're getting attached to the leaflet. Okay, so this is a leaflet here, you can observe. Okay, so there are 2 types of chorda tendinae. One is known as true chorda tendinae, the other one is known as false chorda tendinae. So true chorda tendinae are the one which are arising from the papillary muscles and going to the leaflets, but false chorda tendinae are the one which are arising from the ventricular wall. So you can see they are arising from the ventricular wall. Even there is another type of classification where we have learnt about the 7 types of chorda tendinae. Okay, next coming to the trabeculae carneae. So the roughness in the inflow tract is because of this trabeculae carneae. So trabeculae carneae we have ridges, bridges, and the papillary muscle. So these linear elevations what you are seeing, these are all known as the ridges. These are all the ridges what you are seeing, the linear elevation. Okay. So one more important linear elevation or the ridge what you have to remember is a supraventricular crest. Okay. So this crest what you are seeing here, this is known as supraventricular crest, which is extending from the septum, the ventricular septum till the orifice, the atrioventricular orifice. So this is known as supraventricular crest. Okay. The other important bridge is, so bridge is something which is bridging between 2 structures. Okay, like from the ventricular septum you can see till the papillary muscle. So the important bridge what I am showing here, this is known as a septomarginal band, which is also known as moderator band, which is extending from ventricular septum till the lower 1/3 of this anterior papillary muscle. Okay, so this is known as septomarginal band. Okay, so what is the main importance of this septomarginal band is it is going to convey the right branch of the AV bundle, and it's also going to regulate the over distension of the right ventricle. That's why it is known as moderator band. Okay, the other point or the other structure in the trabeculae carneae or the papillary muscle. So this is a papillary muscle which is a conical muscular structure. Okay, so only the apical 1/3 we have the attachment of this chorda tendinae. Okay, so what I am showing you here is a anterior papillary muscle, and this papillary muscle what you are seeing, this is a septal. Okay, this one is a septal, and if you go posteriorly you can even see the posterior. Okay, this one what you are seeing here, that one is a posterior papillary muscle. Okay, so this is a inflow tract. Now coming to the outflow tract, you can see the outflow tract, it is very smooth. Okay, so here you can see this is the outflow tract. Okay, and the outflow tract apex we are having this orifice for the pulmonary trunk. Okay, which is guarded by the semilunar cusp. Okay, you can see this is a semilunar cusp where you have a dilated portion which we call it as a pulmonary sinus. Okay, and here in the center we will be having a thickening which we are calling it as a nodule. On either side we are having the thin laminae which we are calling them as lunule. Here also you can see this is a nodule, this is a nodule. On either side we can see the thin laminae. Okay, so that is about the right ventricle interior. Now we'll just look at the interior of the left atrium. So what you're seeing here, this is the left atrium. Left atrium is the one which is forming the base. The 2/3 of the base is formed by the left atrium, where we can see the 4 pulmonary veins are entering this left atrium. So these are the 4 pulmonary veins. So if you look at the interior of the right atrium, you can see most of it is smooth walled. It is all smooth. Only in the left auricle. Okay, so only in the left auricle you will be having the musculi pettinator, which is a potential site for the formation of thrombi, just like the right atrium. Okay, So the important point for here to remember is we'll be having a lunate fossa here, okay, which is representing the fossa ovalis on the right side. Okay, so this is the lunate fossa, what you're seeing on the left atrium. And again, what the other structure you're able to see is the opening. This is a left atrioventricular orifice with two cusps or leaflets. You can see two cusps or leaflets which are attached to this mitral valve annulus, or we can say this is a mitral valve complex. Okay, so these two cusps, the bases, they are attached to this mitral annulus. Okay, so now if you look at the interior of the left ventricle, okay, it is almost the same, just like the right side. We have an inflow tract, we have an outflow tract, right? So I'm just not going to show the entire thing. I'll just show you the papillary muscle. So what you're seeing here, this is a left ventricle. You can see all the ridges and the roughness. Okay, so this is actually the anterior papillary muscle which has been cut. Okay, and this is a posterior. This is a posterior papillary muscle, what you can see. Okay, and this will be the outflow tract. It will be opening into the aorta. Okay, which you are unable to visualize here in this specimen.